Hello, I'm Dr. Gottenborg, and what we're doing today is just a little bit differently. We're over here in Monaga in a second practice location, and I think what we want to do today is we really want to highlight a unique aspect of this practice in Monaga. I've worked with a fellow, Ernest Hutta. He's a certified massage therapist. We've been working for nearly 20 years together, and dating back to about 1990. And I'm going to introduce him here in a few minutes, but I think 20 years ago, we were both looking for something different. I was looking for someone to help me more with the muscle aspect. I think Ernest was looking for someone to help more with the structural aspect. And we met, and since then we've been working together. In this location, we work with another doctor, a medical doctor, Dr. Wheaton. And at this time, why don't I introduce Ernest? And Ernest can tell you a little bit about the location, what we do, and our work with Dr. Wheaton.
Thank you, Dr. Dave, for the introduction. As Dr. Dave said, more than 20 years ago, he and I partnered up to create a facility and a marriage of a practice between muscle therapy and chiropractic, in which the synergy and the healing and the rejuvenation of health has been created through that combination. Both of us realized one very, very powerful dynamic. You mentioned Dr. Mark Wheaton, who specializes in a procedure as a sports medicine physician called prolotherapy. And so combined between those three things, if you take away ligaments and muscles, your bones fall to a heap on the floor, and we need somebody like Dr. Gottenborg to deal with the structural components. Sometimes there's a ligament issue, many times there's a muscle component. So the marriage of all of us working together has really facilitated some incredible synergy, working together, and some incredible results in healing and rejuvenation for people's health and pain in particular.
So Ernest, what I was thinking is, why don't you describe a little bit about what a typical visit would be like when you and I work together on a common problem on the same patient?
Well, Dr. Dave, as you have experienced, and I have too, we have a referral-driven practice. And over the last 20 some odd years, we draw every single day on a Thursday when you're here within a 100-mile circumference. People come from a long distance away to see and utilize the services that we provide. And what makes that unique in that a typical person walking in the door is coming in knowing that between the two of us, we can address both the muscular and the structural components of their needs. And many times, if somebody is unstable and they're needing care and help, it's because there's a muscle component involved, or many times it's the other way around. And so one of the things that we like to make sure clients and patients are aware of is that it doesn't really matter who they first initiate the visit with. I don't care that they come to see Dr. Gottenborg first or they come to see us. We ultimately have humility and respect for each other's practices, in which I know they're going to need his care, or he knows they're going to need my care. That's the dual purpose of a practice like this, in which people can receive kind of everything in one basket to come here on a given day. And then ultimately, if we got to the point that after a few visits and sessions the patient doesn't respond the way we'd like, then we can incorporate Dr. Mark Wheaton into that concept. So we again work together, ultimately driven towards one goal, the synergy of all of us together, working towards healing and rejuvenation of people's health.
You know, the last question I'm going to ask you is that in the 20 years we've worked together, we've certainly worked with other therapists. You have therapists here, in fact, 2 or 3. Why don't you give people an idea as far as their background and how they've been kind of brought up to speed with working with both you and I?
Right. So every person that comes into our practice that works under me has gone through massage therapy, reflexology, trigger point, myofascial release techniques, training from many different fields. But ultimately, I really compliment you because you've been such a huge part of helping drive the expectation of how we can complement your work. Ultimately, fundamentally, when people come in here and they have chiropractic needs, and you know there's a muscle component of that, it's been your training over the last 20, 25 years that has helped really refine the technique for my staff to know how do we deliver and help you do your work. And so again, I really compliment your ability to train and educate us to understand the structural components and the musculoskeletal components of that whole relationship. You've done a phenomenal job. Every single one of them are trained under me in utilizing the electroacuoscope, which is the microcurrent tool we have on staff, and understanding the principles, the assessment skills necessary. But ultimately, many times if the patient, particularly is coming referred by yourself, it's driven out of you creating the expectation, and that's been phenomenal help for us.
Okay, thanks, Ernest. Hey, as we finish this session, I want to tell you we're going to continue this to a second session. And again, we're in Monaga today, and we'll run a little trailer here so you can find us, the address, phone number, and whatnot. So thanks for spending a little bit of time with us today.
Thank you.
Thank you for watching Wellness for Life.